Hospital-acquired infections or nosocomial infections are a frequent cause of medical malpractice litigation and medical malpractice cases in this country. The reason is hospital infections are preventable. Not all of them, but most of them, if the hospital has proper safety protocols, and most importantly, the people working in the hospitals are following those protocols. It's no good to have a protocol if your people aren't going to follow it. And that is typically what happens in these cases. The protocols are written under national standards by the medical experts determining how we can best avoid patients, such as yourself, getting an infection just from the hospital. Not from the procedure, not from whatever your injury was that brought you there, but acquiring an infection because the hospital is a dangerous place because there's a lot of bad bugs or bad organisms, dangerous organisms that can be in the hospital. One of the things that hospitals are most concerned about are antibiotic-resistant bacteria. These antibiotic-resistant bacteria can place you at great risk of harm or even death. Another typical nosocomial infection or a hospital-acquired infection is MRSA. And MRSA can have lifelong complications and is associated highly with a mortality rate. So if you have acquired a hospital-based infection and suffered a harm from that, have you lost a loved one to a hospital infection? Have people had to have subsequent surgeries because of a hospital infection? Oftentimes it might not be the fact that you got an infection in the hospital, but the facility or the hospital's failure to diagnose the infection and to timely treat it. The doctors and the healthcare providers know that hospitals are bacteria-ridden, and even though they do their best to clean rooms and sanitize hands, they know that hospitals are dangerous places to be because of the organisms that are in hospitals. If you have picked up one of these organisms, if you have acquired a hospital-borne infection, if that hospital-borne infection has caused you significant harm, call us. Let us look at the case and let us tell you whether or not this hospital infection could have been avoided or whether it was an unavoidable complication of a hospital stay.